afternoon, everyone, and good morning to those who are joining us from the West Coast. Welcome to today's session, Engaging Young People in Tobacco Cessation Treatment, Blending Innovation, Marketing, and Science for Public Health Impact. My name is Selena Degano, and I'm the Senior Program Specialist in Comprehensive Tobacco Control here at PHO, and I have the pleasure of moderating today's session. So before we get started, I'm just going to go through a few housekeeping items. So we're in Zoom today, and it actually allows attendees to have the ability to customize your own view, and you can do so by going to the right hand corner of your screen and choose as you wish. Also, for today's session, we'll be using the Q&A pod. If you have any questions throughout the session, please enter them in there. We will be saving the questions for the end of the presentation, and we'll do our best to answer as many possible. Just to let you know, the chat pod has been disabled to limit any distractions during the presentation. And if at any point during your session you're experiencing any technical issues, please email events@oahpp.ca. And that email is also in the chat pod on the right-hand side. So we'll jump right in. It's my pleasure to introduce today's speakers for our presentation today. We have Dr. Amanda Graham, who is the Chief of Innovations at Truth Initiative, Nicole Doler, as she's the Senior Vice President of Marketing and Media Investment at the Truth Initiative, and Dr. Elizabeth Hare is the Senior Vice President at the Schroeder Institute. And I will pass it on to Amanda to start off with our presentation.
Great, thanks Selena, and to PHO and also your colleagues on the West Coast. We're really excited to be delivering this presentation today to share what is a multidisciplinary effort that we've undertaken at Truth Initiative to engage teens and young adults in tobacco cessation. Nicole Doler, Beth Hare are two of my colleagues here at Truth Initiative. And essentially what we're going to be covering over the next hour are these three themes: innovation in vaping cessation treatment, powerful marketing strategies to reach and engage young people in cessation, and the rigorous evaluation of those marketing efforts. So I'm going to kick us off by describing the development and evaluation of This Is Quitting, which is a quit vaping program for teens and young adults that we launched over 2 years ago now, almost 2.5 years. And the results that we've seen from a randomized clinical trial that we completed last year, the manuscript just came out in JAMA Internal Medicine at the end of May. We're excited about that. Nicole will talk about some of the major insights from the Truth campaign over the past 20 years that she and her team are using to address vaping and to promote cessation for the first time. Many of you know the Truth campaign as being a prevention-focused effort. And so this has really been a major shift for us organizationally moving into this cessation space. And then finally, Dr. Beth Hare will describe how her team in the Schroeder Institute evaluates the impact of the Truth campaign in driving key markers of behavior change among young people. So we really have kind of a nice multidisciplinary lens today. So in the early part of 2018, there was a lot of alarm here in the US about the rise of youth vaping rates. And simultaneously, we were seeing lots of conversations on social media about young people wanting to quit, not knowing how to quit, not knowing where to turn for support. And so the team that I lead in the Innovation Center, we've been focused on digital tobacco cessation for about 20 years, largely focused on adults for most of that time, but really decided that we were kind of in the right space at the right time with the right kind of intervention approaches to be able to step in and really fill a much needed gap in terms of treatment resources. So we started with the peer-reviewed literature on treating nicotine addiction in young people to identify best practices. We spent a good bit of time talking with current vapers, with those who had quit successfully, and we talked with our partners at the Mayo Clinic Nicotine Dependence Center. And the result of all of that formative work is this program called This Is Quitting. And it's a text message program that's designed specifically for teens and young adults to help them quit vaping. It delivers practical, evidence-based advice about how to quit. It's tailored by age, it's tailored by the device a young person is using, and it's tailored to really emphasize support around the quit date. We designed it to be highly interactive, knowing how young people use technology. And so we did that in a couple of different ways. There are a number of on-demand keywords that a user can text in to get support in the moment that they're having a craving, that they're experiencing stress, that they're struggling with mood. And we also ask a number of multiple choice questions, true false questions, open-ended questions, really to drive that back and forth interaction with the user. This is not a program that was designed for young people to just passively receive messages on their phone. All the messages sound like they're coming from a non-judgmental, supportive friend. But what's really unique about This Is Quitting is that many of the messages were written by young people themselves. We have a mechanism in the program that allows users to submit tips or advice or cheerleading kinds of encouraging statements. You got this, I've been there. And what we hear from our users is that oftentimes they feel like they're the only one in their peer group who's quitting. These messages, you can see one on the right-hand side of the screen from Marge. That was a message submitted from a user named Marge, that it tells them, I'm not the only one quitting, and there are people out there who are being successful. And both of those things can be very powerful for young people. We launched This Is Quitting January 18th of 2019, and we were thrilled, surprised and thrilled to see that roughly 2,000 young people enrolled within a 24-hour period. That's that first little blip on the left-hand side of the graph. But the real signal for demand became apparent about 12 days later when Mashable ran a story on their Snapchat channel about our program. And what you can see is that we had more than 22,000 young people enroll within that first 24-hour period. The paper on the right, we published in Nicotine and Tobacco Research to let the academic community know that we had launched this program, some details about the program, and some of our early outcome results. Around that same time, we started the process of integrating This Is Quitting into the Truth campaign to leverage the power of the Truth brand to reach and engage young people. And that's really where Nicole is going to pick up the baton next. We do a lot of evaluation, sort of continuous evaluation of the program. The next couple of slides, I'm going to be talking about our program evaluation effort, and then I'm going to move into results from the randomized trial that we did among young adults. So to date, we've had over 328,000 young people enroll. These are the numbers between January 18th and I think we pulled these about 4 days ago. Any of you who do work with teens and young adults know that getting their attention, getting in front of them and getting eyeballs on a thing is a challenge, let alone getting young people to do a thing. And so we are thrilled with these uptake numbers. You know, the daily enrollment rate ranges from upwards of 500 on any given day. What we also see is that engagement with the program remains high. This has been consistent pretty much since we've launched the program. The majority set a quit date. The vast majority set their quit date for the day they enroll. These are young people who are motivated to break free from nicotine addiction. About 44% are using those interactive keywords to get more from the program beyond the scheduled messages, and 67% complete what is now a 2-month program. When we originally launched it, we made a deliberate decision to keep it sort of light touch and a 1-month program. And what we heard from over 80% of our users through the program itself is that they wanted it to be longer. And so it's now a 2-month program. And we're consistently seeing 2/3 stay with us for that full 2 months. In terms of behavior change, these are the numbers that we track as part of that program evaluation. What you can see is that at 2 weeks, about 68% of respondents report that they've either reduced how much they vape or they've quit entirely. The numbers on the right are 3-month metrics, and what you can see is that they're pretty promising signals of sustained behavior change. 20% reporting that they've not vaped at all in the past 30 days, which we know, given the variability of youth patterns of nicotine use, we were quite excited about these data. And that really led us to want to evaluate this program in a full randomized trial. We get dozens of unsolicited messages back from young people using the program. They know that it's an automated program, but they reach out anyway to let us know the ways in which it's helping. Those are the messages that you can see in the rectangular boxes. I know you can't really respond to this because you're a computerized program, but thank you so much for your support. I've never gotten this much support right off the bat. And thank you, robot. It's nice to have someone to discuss the horrible realities of nicotine withdrawal. They also tell us that they really like that the messages are from real people. Each of the quotes use the username, the first name, whatever somebody submits when they submit those suggestions. And so you can see in the upper right in those cloud quotes, some of the feedback that we've gotten about that sort of real personal nature of the program. They're a good reminder to not vape, they're from real people, and it makes it feel like someone is with you helping. So we've obviously learned a lot, but obviously the key thing was to know that this program actually works and is actually helping young people. And so in December of 2019, we launched, to our knowledge, what is the first and maybe still the only randomized trial of any vaping cessation intervention that we're aware that has been published so far. These are some details about the study. We were super fortunate to have support from the CVS Health Foundation for this work. It was a 2-arm randomized trial that compared This Is Quitting to an assessment-only control. In the assessment-only control, they enrolled, got a confirmation that they had enrolled, and then the only messages they received from that point forward on a monthly basis were queries about their use of e-cigarettes containing nicotine, and then assessments, online assessments or by phone if we couldn't reach them online at 1 and 7 months, a more formal outcome evaluation. The primary outcome of the trial is 30-day point prevalence abstinence. And to minimize dropout, we incentivized responses at each of those monthly text message assessments. Both arms received those monthly assessments, and we knew that if we didn't incentivize, didn't provide something to the folks randomized to the control arm, we were probably going to have a pretty high rate of dropout, and more importantly, differential dropout at that 7-month follow-up. So that was really a driver in the selection of this particular control condition and this particular approach. Our protocol paper was published in the Journal of Medical Internet Research back in May of 2020. So we recruited from the general population in the US using ads that targeted young adults 18 to 24 who were interested in participating in a research study, reported past 30-day e-cigarette use, and who were interested in quitting in the next 30 days. Because this intervention has been so heavily promoted by the Truth Campaign, we wanted to ensure that our evaluation was really able to tease apart the impact of the intervention on its own on promoting abstinence, separate and aside from any of the impact of the Truth brand. And so we essentially white labeled the intervention. We referred to the study as the Quit Vaping Study. We didn't use the intervention name This Is Quitting, and we didn't advertise it as a truth, an element of the Truth Campaign. This is our study consort. For those of you who are familiar with this, this is a research requirement in publishing the results of a randomized trial. And it basically shows the number who were approached for eligibility, those who were eligible, and ultimately the size of the sample that made it through the enrollment steps. And this is really a signal of generalizability. You can see we randomized almost 2,600 young adults. We were able to do this in a little over 3 months in early 2020. This is the bottom half of that same diagram, and it essentially shows you our follow-up rates. The primary endpoint was that 7-month follow-up, and we were really pleased to have a response rate of about 75% across both arms, and more importantly, that we did not have any differential dropout. In terms of the sample, these are some of the kind of high-level demographic characteristics. We had an even split between men and women. We had nice diversity in terms of race, an overrepresentation of sexual minorities, and roughly a third who reported financial struggles. It's often talked about that e-cigarettes are not inexpensive, and that maybe this is a behavior that is more common among those who come from families or young adults who are living with a little bit more means. And so we were interested in understanding the financial context, and had about a third who reported on this subjective measure barely or not meeting basic expenses. In terms of tobacco use behavior, 93% say that they vape daily or almost daily. 82% vape within 30 minutes of waking. We know that that's long been a marker of nicotine dependence. And we saw a third who were dual user cigarette smokers, and a very high proportion who had tried to quit multiple times in the past year. These are data from the Hooked on Nicotine checklist. This is a well-validated measure of nicotine dependence. And what you can see just scanning down the right-hand side of the table, those are the proportions of young people that endorse these items. These are all yes, no questions. And it includes 94% who said they feel like they're addicted to vaping, 93% who have strong cravings to vape, 82% feeling irritable when they haven't vaped in a while. And so this really starts to give us a sense of the struggle that this sample was having with quitting vaping. In terms of other substance use, 59% reported past 30-day marijuana use. We know that that's common, and so we were not totally surprised to see this. 25% report vaping marijuana at least weekly. Young adults, maybe not surprising that 3/4 reported past 30-day binge drinking, pretty typical of this age range. We administered the PHQ and the GAD as screening items for depression and anxiety. And you can see the proportions here that exceeded the cutoff that would signal the need for further evaluation. When we look at the PHQ and the GAD together, 51% of the sample exceeded the cutoff for either of those. And so these are young people who clearly are struggling not only to quit vaping, but with a number of other mental health and substance use challenges. So this slide shows the main outcomes of the trial. Under intent to treat analysis, which is counting all of the non-responders as being current vapers, participants randomized to this is quitting were almost 1.4 times more likely to report 30-day abstinence at that 7-month follow-up. Framed another way, 40% more likely to be abstinent. And interestingly, we saw the same magnitude of effect under complete case analysis. So that's just looking at those who responded to our follow-up questions. We see roughly the same results. And you can see the raw abstinence numbers here, 18.6% in the assessment-only control and 24.1% in this is quitting. I often get asked, but text message intervention, that's probably good for lighter vapors or those who might not have many challenges, but, would this program work for young people who are struggling with higher levels of nicotine dependence with other kinds of substance use. And so we looked at a comprehensive range of baseline characteristics to really answer that question. And what you can see is that we saw consistent effects with this is putting outperforming the control in promoting abstinence across all of the variables that are listed on the right. We looked at demographic characteristics, we looked at a number of different tobacco use variables, and also that other substance use and mental health data that I presented earlier. And so, the conclusions, we're kind of excited. Again, to our knowledge, this is the first randomized trial of any quit vaping intervention. I know that there are groups throughout the US, likely in Canada also, that are working feverishly to fill this gap. And so we're excited for this program to really establish a benchmark and to give other research efforts a point of comparison to start to build the science in this area. The study demonstrated the effectiveness of a tailored and interactive text message program. We know that this is a scalable modality and can be effective in helping young people to break free from what we know can be a very tenacious addiction. And so with that, I will pass the baton over to Nicole, who will take it from here.
Thanks, Amanda. So Amanda gave us probably the best product we could have in order to market it. So what I'm going to talk to you a little bit about today is I'm going to talk to you about this challenge that we took on, vaping. I'm also going to tell you some of the lessons learned, some of the campaigns that came as a result of the learnings, and just things that you can take away for your future thoughts when you're doing something around cessation or prevention. So if you can go to the next slide. We have been taking on the #1 cause of preventable death in the United States for decades. But our battle against youth addiction got a lot harder when vaping came on the scene. And the only way to take on this new challenge of vaping was to obsess about relevance. Young people are fickle, hard to read, constantly evolving, and the vaping epidemic starts young. We knew from all the data that I think in 2019, it was somewhere around 27% of individuals had vaped in the last 30 days. And if we were to get it wrong, we were going to be mocked. But probably worse than that, we could be ignored or irrelevant. And what would happen? Well, vaping rates would just creep up. So youth culture is where the battle is fought and won. So we need to stay eternally relevant. In this endless churn of youth culture, when a 15-year-old is constantly obsessing about their relevance and stressing about it, we need to be better. We need to care more so that we can save lives and change lives. So we can go to the next slide. So I'm going to tell you how we learned about our audience. And I think this is always the most important step that you do in anything when you're doing something in marketing, is really understand the generation and the individual that you're trying to reach. And in this case, we're really trying to reach Gen Z. And this is somebody that is between, under 24 years old, approximately. And they've grown up in a time of nonstop adversity. The difference between this generation and others is that it hadn't broken them. It hadn't hardened them in the way that it made them like the Gen X, sort of that negative pushback that we got from the Gen X, or the millennials who kind of looked at it as, well, we'll do this all together as a collective. This is a very resilient, determined survivor. So we have to understand who they are and evolve with them and have our message evolve with them. If you can go to the next slide. Therefore, we named this generation the unconquerable generation. As I said, they were shaped by a world of adversity. The result is resilient generation who is determined to create change on their own terms. They see themselves as heroes with the capability to take on anything and make a positive impact by creating solutions. They feel they're being messed with, and if they feel they're being messed with, they're going to make big statements on behalf of their generation against all those in their way. And you've seen this happen, just the things that they've gotten involved in just the last year with GameStop and rethinking how finance is actually done. I mean, they've gotten involved and been more pragmatic, realistic, and yet disruptive than any other generation. You can go to the next slide. So this is really something that we use as a filter for everything that we do. When young people see us as one of them, not an authority figure, we're the most impactful. This is a generation that has technology at their fingertips. They can find any answer in a split second and have an argument with you. And I can tell you that's very, very true, considering I have a 17-year-old in my own household who will constantly argue with me and grab his phone and tell me I'm wrong if I state anything that might be against something that he's seen or read. They're one of the most informed generations we've seen. You can go to the next slide. So I'm going to take you through now that you understand who the audience is, some of the insights and strategies that led us to the different ideas, creative ideas, and big picture ideas that we put into the marketplace. You can go to the next slide. So I think the number one takeaway that we got back in the early days, 2019, is that we talked to the audience, and what we heard was that vaping and juuling represent a gray area in their minds. And so they don't know, they know it's better than smoking, but the rest sort of was a mystery to them. One of the quotes that we heard from a male jeweler was, "I know that there are other chemicals in the vapor. They're bad for you. I just don't know what they are or how bad they are." And really what we found was that there was a knowledge gap when it came to vapes when they first came on the scene. There was a lot of misinformation about whether there was nicotine in there, whether they were good or bad. They weren't even questioning where they were being manufactured or what was in them. And so we decided to take that insight and basically determine a creative idea off of that. So if you can go to the next slide. So the deep insight that we had for our creative execution was that Juul doesn't know the long-term health effects of its products. And the strategy behind that was to expose Juul's deception and manipulation in using an entire generation as lab rats, as a huge experiment. And we know that humans in general will always stand up for animal rights. So we thought, let's turn that on its head. So if you can go to the next slide, Amanda. We decided, what if animals protested on the part of humans? When animals get tested, humans protest. So now humans are being tested on by Juul. Animals are going to return the favor. So we created a series of ads allowing the animals to speak on behalf of the adults, telling them that they are being tested on as lab rats in something that nobody knows the long-term effects of. We found that to be utterly successful. And as we went forward, obviously more information came out about juuling, and we started to see other insights that would lead us to other creative ways in to this conversation. So our takeaway number 2 was that juuling is ubiquitous in their worlds. There is a conscious desire to be part of the trend. They would be seen as weird if they didn't participate. And one of the male jewelers said, it's kind of like a trend. That kind of happened. You see it on Twitter and you see ads, you can put cool stickers on it and things like that. So it just felt like it was just sort of this social, cultural moment that was happening in society that they had to be a part of. If you go to the next slide. There was also a takeaway that Gen Z, unlike millennials, recognize that they are influenced by their peers. So with millennials, they would say, oh, I'm my own person. I do all my own decisions. I make my own choices. But Gen Z seemed to be a lot more pragmatic and admitted to the fact that social anxiety and social peer pressure was something that was real to them. They may not call it peer pressure, but instead they see it as a social lubricant. So it's definitely useful at parties. Like, it gives you a conversation starter for sure. I've even gone up to strangers and started talking, but it's almost not weird because everybody does it. So in an age of technology where their devices are in their faces 24 hours a day, there is a need for human connection, but there is an awkwardness to that human connection. And the vape basically gave them the catalyst that they needed to have those conversations and connections. So we took that social idea and we had an insight. And our insight was that young people think vaping is a social lubricant. The social aspect of vaping is the barrier to quitting. They don't want to be the only ones not vaping. So let's co-conspire with the audience to make quitting feel like a social phenomenon that everyone has to get in on. So with that came the idea of Ditch Juul. So if you can go to the next slide. So let's throw gasoline on the cultural fire taking hold on social platforms by showcasing young people ditching their Juul in fun and creative ways to make it something young people don't want to be left out of. And what we were seeing was we were starting to see a social trend happening on some of these platforms like TikTok, where individuals were starting to get fed up with the fact that they were juuling, and they were starting to destroy their juul in a very physical way. So we wanted to amplify that and shine a light on it, which would allow peers to talk to peers. The next campaign that I want to talk to you about and takeaway is takeaway 4. Young people have realized there are consequences to vaping. It can weaken your immune system, like COVID, and can damage the lungs, like Ebola. So one of the quotes we heard was, "I quit vaping due to pure paranoia, fear, and anxiety. And man, let me tell you, these nic urges are hitting me like a semi-truck." And so we felt like they had been primed. They understood the information that it safe or wasn't safe, that e-cigarettes and vapes were not necessarily an alternative that they should be trying as a first use. And we also communicated with them that they need to do the research that they are so strong on, that they should go online and see what is in the things that they're putting into their body. And now we felt that it was ripe for a deeper conversation because of the circumstances of 2020. So you can go to the next slide. So the insight here was that young people want to quit vaping more than ever before. And we saw it when we looked at Twitter trends and we looked at social listening. We found that there was just huge spikes in conversation around wanting to quit and not knowing how to quit. They think they should be able to just do it on their own. So they believed it was a solo act, that they could just do it one day and it would be that easy. And what we decided to say is, no. You obviously have never been addicted to anything before. Let's show young people that successful quitting is not a solo act, that quitting is a group activity grounded in support. And quitting is also grounded in support. As Amanda spoke to earlier, it is made by youth for youth, and youth are constantly giving each other advice. And I think that is a really big differentiation point in this product, because it allows for the voices of their generation to be heard, who understand where they're coming from. So if you go to the next slide. So what did we decide to do? Well, I guess it was in the beginning of this year, we decided to do a campaign called Quit Together and create the first ever social experiment on TikTok and Instagram stories around quitting by enlisting 3 influencers, Victoria, Touche, and Jerry Perpdrank, who are probably between them have about 11.6 million followers, over a 6-week quitting journey, and had them chronicle their story to their audience. And really the thought behind this was to get not only the support of their other influencer friends who jumped in and helped and gave advice, but also the support of their followers who could see that this was it was basically normalizing quitting and denormalizing vaping. And this has been a huge success for us. We have seen amazing engagement with this. I think right now with this campaign, which we then followed up a phase 2 of this campaign. If you can go to the next slide, Amanda. In phase 2, we wanted to jump off the success of Quit Together, which were these influencers, under the idea that young people are afraid that quitting is too hard and uncomfortable. So they don't want to fail. So because of this fear of failure, let's demystify the quitting vaping experience by showing them the actual ups and downs of quitting journey through just regular everyday people stories. So at the same time that we had Quitting Together on air, we created a series of 5-minute long form episodes with 6 individual quitters. If you can go to the next slide, and followed these individuals during their quitting path. Each of them embarked on this quitting journey at a different point. Some of them were just trying to set the date for the quit. Some had already quit but wanted to stay quit. Some were just getting started and using this as quitting as their process through it. And what this actually has ended up doing is we are now in a place where we have over 1 billion views of this content along with the Quit Together. We have engagements in the multi-millions, and we're feeling really confident that we're making a big dent because, as Amanda mentioned, we are now at a point where we're bringing in upwards of 500 people a day joining This Is Quitting and changing lives. And I'm really proud of that. And I'm proud of my partnership with Amanda and Beth. And with that, I'll turn it over to Beth to take you through the science behind the campaign.
Thank you, Nicole, and thank you, Amanda. So So I'm going to get to wrap us up, and then we can turn over to questions. But my job with the Truth Campaign is actually to look at the impact of what is happening there. So can you go to the next slide, Amanda? Oh, Nicole, this is still you.
Oh, sorry. Thank you.
Okay.
If you want to take on the marketing, Beth and I worked long enough together that
I could do it, but yeah, but I'll let you go ahead and finish up these few slides.
So one of the things I wanted to do at the end of this, and I forgot that I added this last minute, but I think it would be helpful for everybody out there, is I put together 4 just general lessons on marketing that I have learned in taking on this very challenging topic of vaping. One of the lessons that I learned was that we need to channel momentum. And the reason I say that is when we put out this idea of tested on humans, where animals were protesting against human testing, what we found was that, sorry, I was talking about Ditch Joel. What we found when we did these things is that we would be able to capitalize on what was happening in the marketplace. So for this particular images that I'm showing you, like I talked about earlier, for Ditch Joel, we found that after we put this into the marketplace, more and more TikToks and Instagrams and Snapchats were being pushed out around them deciding that they no longer wanted to be part of vaping and denormalizing the activity. If you can go to the next takeaway. When we did the tested on humans, how we channeled momentum there and also went for the jugular is that right after we launched the tested on humans campaign, the Juul CEO actually went on CBS News and was asked in an interview almost a week after we launched whether there were long-term effects to vaping and whether they were known. And right on CBS this morning, he said that he did not know the long-term effects of vaping of his product. As a result, we utilized that footage from that interview and immediately edited a piece and pushed it out across all of our channels so that it wasn't truth that was telling youth what they knew or did not know, but the CEO of the actual product they were using did not know what effect it would have on their bodies. So we went for the jugular and we channeled the momentum of what we saw in culture here as well. So you can go to the next slide. Takeaway 3 was that we always empower the people they actually listen to. And you saw that with Victoria and Touche and Jerry Perpdrank with their followers. We let the message come from the individuals that they look up to, the influencers that they follow. And they've watched these influencers start at nothing and they feel like they have been a part of their growth process. So this is somebody that they trust and that they listen to. So we channel our momentum by using those individuals to tell our story for us. We can go to the next slide. And the final takeaway that we've learned is that we need to build a bigger boat. And what I mean by that is that it's not enough for us to just go into the marketplace and create one campaign and hope that that handles all of the different messages and ideas that we need to communicate. So what we do is we partner with people like The Onion. We partner with other groups or other media outlets like Adult Swim in order to create content that they can put on their channel that comes from both their channel and our channel in order to share that brand equity so that we can have other messages out in the marketplace, whether that's an anti-industry message, whether that's a social acceptability message and that nobody's doing this anymore. But whatever those messages are, they come around and they complement what we do on a national level so that we can really connect and use the momentum and the equity that these other platforms have with their own audiences. So if you go to the next slide, I'll just recap. Basically, we channel momentum by looking at the culture and seeing what's happening in social listening and constantly try to tap into culture and change and modify. We go for the jugular. So when we do see something in culture, we immediately jump on it, utilize it, and allow that to be the message for the consumer. We empower the people that they actually listen to, that they care about, which is not an adult and is not us. It is really going and utilizing influencers and utilizing media partners. And then we also utilize those media partners and influencers to build their own content and their own voices so that we can complement our message with other messages surrounding them. So that's the main takeaways, and thank you for your patience. And I'll turn it back over to Beth.
Okay. And so I'm going to spend the next few minutes talking about our research and evaluation around the Truth campaign. Next slide. Yeah. So we've got several campaign objectives when we are trying to evaluate the Truth campaign. And the first is to increase campaign-related knowledge, attitudes, and beliefs. And we've got such wonderful content to work with that helps. We also try to reduce intentions to vape, as well as to reduce initiation of vaping, and then to reduce progression to an established vapor or a heavier or more frequent vapor. And then with this cross fertilization between the Truth campaign and This Is Quitting, we're also wanting to look at quit attempts among our user populations. Our evaluation is multi-pronged. We have a robust formative evaluation where we work hand in hand with marketing to actually make sure that we're putting out the best possible quality content before it ever even walks out the door. Today, I'm going to focus on our implementation research and our impact research. In our implementation research, we have a weekly cross-sectional survey of about 300 individuals, where we can really see what's happening in that on an ongoing basis. And then in our impact research, we're looking at our longitudinal cohort, where we've had over 14,000 individuals in that cohort that we have been following since we originally launched in 2014. Amanda, you can change to the next slide. So we have a model for change. This model for change was based off of work that we had done within our combustible work, where we really believe that once we have a public education, mass media campaign, that we can see some short-term outcomes in terms of increases of knowledge and shifts in attitudes and beliefs, somewhere between 6 to 18 months. And then longer-term outcomes will start to appear somewhere between 18 and 24 months. Now, this was based off of combustible research with combustible products. And so here we're now working with vape products. And so we were hoping that the same timeline would also be true for vaping behaviors. Next slide. So our first study is from our continuous tracker data. We used data from December of 2018 through, from October of 2018 through December of 2019. So a little over 13 months worth of data. This sample had over 8,400 individuals within the data. And here, what we were really expecting to see changes on were changes around knowledge and attitudes. And sure enough, that is what we found. We had shifts in knowledge that were the key messages of the content that aired during that time. And you saw some of that with our tested on humans content around, as well as our early content that really talked about some health consequences of using the vaping products. In addition, we pushed on some of our vaping related attitudes. And this is around perceived product harm, social unacceptability, and anti-industry. We did not push on unappeal because that was not something we were messaging on at that time. And so we were actually happy to not see a finding there. So again, truth ad awareness significantly was associated with campaign targeted knowledge and attitudes. I say that it's under review here. I'm happy to announce that just last week we found out that it was accepted. And so it will be out shortly in tobacco control. Next slide. So we also wanted to look at the impact in our longitudinal cohort. Here we are using a measure of brand equity, and this measures the affinity of individuals for the Truth brands, things like likability, identification, loyalty. And here we're using it as a proxy for ad exposure. So we wanted to assess changes in brand equity over time in relationship to those campaign targeted attitudes, intentions, and behaviors over time. We used data from wave 7 through wave 9 of our longitudinal cohort. Wave 7 was in the field from February through April of 2018. So that is prior to us launching our campaign in that fall. Our second wave was in the February through April of 2019. And then we looked at outcomes in the fall of 2019. And again, here what we found was that increases in brand equity over time were significantly associated with higher campaign targeted attitudes, beliefs, and intentions not to vape. And again, that this paper was just recently accepted for publication as well. And then our final study that I'm going to talk about is looking at our intentions to quit work. So really focusing on our user population. This data is using our continuous tracker. These analyses focused on January through June of 2020, so only about 6 months, and focused primarily on our Ditch Juul campaign. So here we have a sample of about 1,300 individuals. And what we did find is that among those users, if there was higher ad awareness, we had higher intentions to quit. We also had some increases in their attempts to quit over the past 12 months. We had increases in perceived norms about quitting and increases in around knowledge that there are programs that are out there to help young people quit, like This Is Quitting. So really super excited about this. We are in the process of actually extending these analyses right now to include our current campaign that Nicole described around quitting that just aired. And so hopefully we will get that paper out for publication shortly. So during the life of the Truth campaign and the work that we have done around our combustible work, we know that we have prevented over 3 million youth and young adults from smoking. And with these findings, the work that Amanda's doing, the great work that our marketing team is doing, we truly believe that the Truth campaign will be able to help turn the tide on vaping behaviors as well. Thank you.
Thank you to Elizabeth, Nicole, and Amanda. So we're going to get started on the Q&A portion. So if you haven't already, feel free to put any of your questions that you have in the Q&A chat at the bottom, and we can go through and ask some questions that come up. So the first one I'm going to put out to any of the presenters today is, what were some of the biggest challenges with the shift between the two generations that you had with creating either the program and or the campaign? And I know, Nicole, you brought up a number of them already. And then potentially also that you identified some of the differences between the millennials and the new Gen Z. But what are some of the, I guess, commonalities that you were able to work off of to build some of the campaign work that you did?
I can talk a little bit about this. This generation is the first generation to be born out of 3 other generations. So they are a product of boomers, millennials, and Xers, whereas previous generations didn't have that kind of mix. And the really big difference between the millennials and the Xers is the millennials really wanted to work within the system. They wanted to work as a collective, and they wanted to make change but follow the rules. Gen Z is not interested in following the rules. They feel that they've been let down, that the adults haven't picked up the torch. They should be held accountable for that, is what they think. And it's interesting because we hear today a lot how there's so much hope in the Gen Z generation. Well, the Gen Z generation's answer to that is, great, if there's so much hope in us, then give us your power, you adults, give us your seat, and let us make the rules and let us make the change, because you seem to have not gotten there. And I think they do it in a very clever, humorous way compared to an angry way that Generation X did it. I think they have weaponized memes to make them work to their advantage. I think they have hacked Instagram. I think they believe that there's nothing that they can accomplish if they do it in a clever, outrageous way. So that would be the big difference there.
Okay, thank you, Nicole. Amanda, did you want to speak to some of the challenges that you had with adapting the program for the new generation?
I think probably the biggest thing that I would note is the challenge of being a first mover in this space. You know, I talked about the literature that we reviewed in terms of youth cessation. At the time, there were I think 2 or 3 case studies that had been published of 3 young adults that had worked with a pharmacist, a primary care provider, and those experiences had been published in case report kinds of descriptions. But there really was nothing for us to lean on in terms of the adaptation and the specific needs of young vapers. And so that's really why we spent as much time as we did talking to as many young people as we did to understand the language that they use, how vaping fits into their lives, the perception that they had about quitting, the motivations for quitting, to really be able to create a program that wasn't just find and replace smoking with vaping, but a program that felt relevant and really addressed some of the major challenges. And the idea of using as many user submitted quotes really came out of that formative work. We heard over and over again, young people talking about how lonely it felt, how isolated they felt, some of them being bullied with trying to quit, because in their peer group, guess what? Everybody was on the upswing with this behavior and discovering flavors and, cool vapor tricks. And so seeing messages from other young people really resonated with, some of the early feedback that we got.
So while the Truth campaign, and I mean, we do see it in Canada, but it's not part of our traditional advertising. And then the This Is Quitting program is only available to those in the US. What are some of the, pieces of advice that you would offer to those that would like to get started on creating a similar campaign, obviously not to the same scale, but where should people get started? What are some of your best lessons learned? Those sorts of things.
Yeah, just to clarify, I answered this question in the chat box. So we were established as part of the Master Settlement Agreement that happened in the late 90s. And as part of that charter, our work is restricted to delivering service within the US. And so that's why, our focus is on young people within the US. Having said that, I will tell you that I have had probably no fewer than a dozen discussions with various provinces, various folks across the provinces who are asking all of these same questions. We do have the ability to license content from the program itself, to share our evaluation work on an ongoing basis. And certainly Nicole can speak to this, but to serve almost as a consultancy, we can obviously share the assets that were produced. There's all kinds of, legal mumbo jumbo that surrounds the contracting process with, the influencers that Nicole and her team work with, but certainly to provide that kind of coaching and direction and to steer people away from some of the pitfalls that, we've navigated our way through.
I think just to add to that, I think the only advice I would give is that unlike any other cohort, meaning any other group or audience that you have to market to, adults are much easier. Young people are so fickle and changing, and they will call you out rather quickly. So I think, one of the lessons I learned was that you have to move very, very quickly for them. So when there was a knowledge gap, we had to move quickly to get that information out. When there was a social anxiety aspect, we had to move quickly to try and tap down that social anxiety. Right now, what we're seeing it as a coping mechanism during the COVID and the VLI. With all of the things that happened in 2020, I think this audience is very stressed out and has a lot of mental health issues right now. And vaping is a tool for coping. And so we're really thinking quickly about how do we bring that to life as fast as we can, because that, they'll be on to something else tomorrow.
Great, thanks. So also kind of to build off of that, so you spoke obviously about the quick moving and having to adapt constantly. So what are some of the strategies that you've employed to keep young people engaged in the process? And how do you stay on top of what's happening in that world for those of us that aren't actively involved in that world because of our age, or we don't have those individuals in our lives daily?
Well, we actually just put together a youth panel that we utilized across the United States. We had numerous people apply to be part of this panel. And these were people that were both vapors and non-vapors alike. They're within our 15 to 24 age group. They have certain passion points that we need to understand, like whether it be gaming or esports or music or anything else that they're interested in, photography, art. And we use that panel for everything that we do, just to touch the stone on a monthly basis. They help us to understand what's happening with the generation, what's the newest, latest thing that they're using, whether it's Discord or something else. We also use pre-market testing for everything that we do with our target audience, so that, and probably Beth can speak to that at more length after I finish my answer, but we also do social listening, where we create what we call Gen Zine, which is a little magazine per quarter for everybody in the Truth Initiative family, so that it's not just marketing that keeps all the knowledge of the audience to ourselves. We share it with everybody so that they understand, what is happening in youth culture, whether it be about vaping and tobacco, or whether it be just about something else that seems to be a cultural phenomenon. So those are some of the ways that we tap into it, as well as conferences and partners that we have in the space, because we work with a lot of media partners who do a lot of research. And so it's great to be able to tap into all their research for free. So I think we have that luxury, but I'll turn it over to Beth.
Yeah, and I didn't talk a lot about our formative research today, because I could spend a whole hour with Nicole and I going back and forth on the formative side of the actual campaign development. But a lot of what you're talking about falls within that context. We're doing qualitative focus groups. We will run quick surveys. We will be talking to the youth and young adults, trying to figure out what's going on. We also, as I said, have that continuous tracker survey. And so if we think that something is coming up or there's something we want to monitor, we can put questions in that and kind of have it on and be tracking it for a little while to see whether we think that this is a hot point or not that we might want to address. But all of those things are happening on an ongoing basis. And Nicole and I are in multiple meetings together every week, trying to make sure that we're staying on top of this and that we have the right information, the right science facts that are the basis of our content. I just got an email in that was like, hey, I need to approve something for marketing. So there's this really collaborative back and forth process between the research team and the marketing team to make sure we stay on top of what is relevant. And then we move very quickly, much faster than I think most other groups could even imagine.
Yeah, one thing I'll just add to that, I talked about the responses that we get from users of This Is Quitting. They go into the equivalent of an inbox, right? It's a text message, but it sits in an inbox. And that's something that we monitor every day. We monitor it, for safety considerations to make sure that that we're being responsive in circumstances that require that. That's a wealth of free, really interesting nuggets where we're able to look across dozens and dozens of messages on any given week to see the kinds of themes that are coming up, to see the reactions to particular messages in the program, to evaluate, the extent to which what's happening out in the real world is being reflected in some of those responses from young people. And that has also, I think, added a layer of rich insight into the process that Beth and Nicole have talked about.
I agree.
And just to add to that, some of the insights that she's derived from This Is Quitting has actually led to the messaging structure that we've used for some of the things that we do to convert people into the program at the very bottom of the funnel, where those individuals are ready to quit. And it really helps to tell them, the reasons that they need to quit now. So it's not just anecdotal, it's something that's actually actioned in all of our messaging. So thank you, Amanda.
All right, thank you. So as we wrap up today's session, I would like to thank Amanda, Nicole, and Elizabeth for their amazing presentation, and our events team for all the behind the scenes support to have this webinar up and running. I would also like to thank everyone who joined us today for today's session virtually. It's great to see a number of people coming out to participate in such a challenging time for those working in public health and healthcare right now. And I just wanted to flag for you that you'll be receiving a brief anonymous survey for today's session. And if you could take a few moments to fill it out, it will help improve our programming, provide feedback on the current session, and gives you opportunity to also provide some suggestions on other topics or areas that you would like to see in the future. So I'm going to say thank you to everyone. Have a wonderful day and a great weekend.